What does a spinal cord stimulator look like on x-ray after implant? Well, here we have two pictures that'll show you exactly what the spinal cord stimulator will look like on your x-ray inside your body after the implant, and what we're looking for, what landmarks we're looking for to make sure the implant is in the perfect place and make sure it hasn't migrated. So here we have what's called the AP view. That's looking from anterior to posterior. And this is your right side, this is your left side. So it's flipped in how you're thinking about it. These are the two leads that we fed up all the way into your spinal canal. And one of the leads will usually go to the mid or the tip of T8, and the other lead will be mid or tip of T9. And how do we know how to count from here? So we'll sometimes count all the way from the head, sometimes count from all the way to the bottom, but one trick is to look at the last rib, and that's your T12 rib. So you have T12, T11, T10, T9, T8. So we know this is the T8 vertebral body. Then as we follow these leads down, so this is what does all of the activation of that stimulation, which blocks that pain. But then that needs to get its information and its energy from somewhere. So the leads will follow all the way down. You'll see these two little marks here. Those are the anchors. Those are what are tied to part of your fascia or your muscle inside your body so that these leads don't move. When you're bending and twisting and lifting, we don't want these leads moving up and down your spine. One, it could cause some discomfort. Two, it could cause decreased pain relief. So after you see these two little anchors here, you'll see the leads then continue down to right here, which is the battery and the computer. And this is what's all the brain of the operation. This is telling the leads up top here what signal to send out, and it's also holding that charge for you. We then look at it from the lateral view, and we'll be able to see all these things on the lateral view as well. So you have your leads going up all the way to T8, and then you have your battery coming down here with the two anchors in the muscle, the fascia. They're not inside the spinal cord, those anchors, those are outside. And that's where we use those little needles to get into the spinal cord. One other thing you should note on this lateral view is that it's called dorsal column stimulation. We want those leads to be in the dorsal or the posterior aspect of the spinal cord. The vertebral bodies are here, your back is here, your belly's here, the spinal cord is here, and we want the leads to be on the dorsal column. So that's what this will look like on your x-ray. That's what we're looking at as physicians to make sure that it's proper positioning and that you're getting the good relief you want from that Nevro system that we place for you.